Hello, my name is Christian Jackson. I'm a licensed professional counselor supervisor here in South Carolina, and I'm here to bring you a presentation about rewriting the father wound through secure attachment. We are going to be spending some time here today discussing a few things about what attachment theory is, what it matters in relation to what I'm also going to call daddy issues. So you will hear me interchangeably discuss the father wound and daddy issues, and that is the same thing, just so we're talking about and we're on the same page. So let's get started. And I want to do so by kind of getting through to you with a personal story. I am also a PhD student. And so, what they call me search is really what's happening with me right now, not just research. I started this work with keeping in mind my own personal relationship with my dad and just all of the other conversations I've been having with clients over the last probably 5 or 6 years. So I've been writing about daddy issues since 2020. And I'm happy to bring to you what I know you probably have seen before when you have done your work. So let's get started with considering a client you may have seen, a person you may have been. A 20-year-old young woman comes into your office. She came to counseling because every relationship ended the same way. She was feeling abandoned, possibly rejected, unseen, unworthy. All these things come up when she's in her relationships. And I'm not just talking about romantic relationships, which we're going to get into, right? So, as we know, clinicians and doing our work over this time, there is a system and there are different relationships that, of course, kind of pull up those different connection definitions. And so I want us to keep that in mind as well. And so this particular student that I see, and or the person that I've been, her father has been emotionally absent. And those are the early parts of her relationship. She's seen and unfortunately has had an emotionally absent, possibly a physical absent relationship throughout her childhood in terms of that connection with her dad. And those early experiences were like a template for her, possibly created a blueprint and a pattern that she kind of unintentionally carried on throughout her life. And the story is not just about her, it's about understanding how our past can shape our present. It's really important for us, of course, as clinicians to teach our clients that. And as we explore further, think about how these patterns might resonate with your own experiences or those around you. And this is my cue to remind you if you're watching this now, so please take care of yourself. I will be doing the same. I have a little bit of a fidget toy here with me because this can be a triggering topic, right? We're talking about daddy issues, and that's not something that a lot of people like to discuss. And so I want you to pay attention to your body, model for yourself in this moment what you can take into session. And so I just wanted to give you permission, if you will, to do that for yourself. And on another note, continuing on this personal journey and kind of me just sharing a little bit more about myself, this is my family. And this is something that I did not believe that I would be able to have, not only because of daddy issues and the rupture that I have between myself and him, but because of the family unit that was split when my parents divorced. We also know that there are definitely some implications about relationships in broken homes, quote unquote. And this is our chance to talk about how deeply rooted those messages can be. And my work with clients, sometimes people are who they are in spite of their parents, and you've only worked just to prove someone wrong. And to that, I challenge that by talking about who actually has the control. But this is a testament to who you can be despite relationships you have. And I have this on here as a reminder to myself of how sensitive I can still be to my father wound and how sometimes it shows up where I'm insecure or I'm questioning who I am and how I'm showing up even with my children. And so again, I know I talked about it a little bit earlier, the father wound is not only going to affect romantic relationships, which is what a lot of people think of, right? We're talking about professional spaces, those with your children, those with your friends and things like that. And this is just something that I want to keep in mind just for myself too. And I also learned that if you show a picture of your family, then people will listen and they'll like you better when you're speaking. That's some kind of research I saw, right? It's just a little joke there. So there we are. And I really want to get into why we're even talking about the father wound, right? They shape our emotional regulation, our physical regulation. And that is something that is really important to keep in mind as clinicians and as we are facilitating sessions is how deep does this work go? How impactful is it that we have early childhood relationships that dictate how we see things and how we show up, right? So they shape our identity. Who am I if I'm not a daddy's girl, if I'm not making him proud, or if I'm not the son that my father wanted, etc.? Who am I? And I know that you've had those conversations just like I have in sessions. And boundaries, they dictate how close we get to people, how much of a wall we may put up when we're in certain things. And so I'm going to ask you as we continue through this presentation together to consider those interventions that you're already using and just shift and open your mind. Let's be lean into whatever discomfort you have while again taking care of yourself. How will you ask questions during an assessment, all the way from intake through termination with your clients with this new information? And so clients reenact early patterns, right? As we get into adult intimacy, they're replaying or we are replaying what we've seen before. And again, like I've said already, that sometimes we do things in spite of, just so that we can prove ourselves worthy, if you will. And also, understanding the father wound helps us intervene intentionally when it comes to attachment work, when it comes to doing the things that we already do. It's not just behaviors. We like to get to the root of things, right? It's like why we are here to do the work. And there are probably many other whys that I can give you, but we only have an hour here together. So let's get into what my goals are for today, and not really in any particular order, but I just want to show you what I have planned for us today. And so that would be to make sure that we are identifying what these father wounds are. We're going to get into more what that looks like. The behavioral piece and the emotional patterns that come with it. That's going to be showing up. And then after we establish some definitions and the what, I don't want to just trigger you without somewhat of a solution, right? So we're going to get into the GRACE method, which is a trauma-informed intervention to support clients that I've created after writing about daddy issues for the last 5 years. I want to give us some language and an easy system that I believe to be pretty simple and I've seen work in my own sessions with clients. And then we're going to talk about what these clinical risks are. Again, not in any particular order, just keeping that in mind. What happens or if we don't address these things? How does that affect our relationships and the way that we see ourselves, as well as our clients and how they see themselves? So I wanted to put some clinical backing, some evidence-based backing to what we're talking about. Just a couple of studies I found in preparation for today. And SCORE is going to come up again later, but I wanted to introduce his work that integrates neuroscience and attachment research. And so he did that to explain how early caregiver interactions, like that of a father-son, father-daughter relationship, would be, and how that shapes the development of the right brain. And the right brain is where our emotions are housed, it's where they're processed, it's where that relational piece comes in. And so it is really the seat of emotional regulation. And so what they found was caregivers who are inconsistent or emotionally unavailable, it kind of rocks the child's nervous system. The child will learn dysregulation. It's like their default. And so stress and relationship threats later in life, they trigger the same flight or fight or freeze reactions, just like any other traumatic event. And so this is where we pause and say, yes, it's important to talk about the father wound and daddy issues because that attachment rupture can be traumatic for people. So the clinical takeaway I want us to have here is that reparation requires relational safety and co-regulation. And so we do that through therapy. We have to calm the body first before it can really receive or information and really process different narratives in our trauma work. And so before we can change that story, how do we ground ourselves? And that's what we're going to talk about with the GRACE method. And this is the research that shows us the importance of making sure that our body knows it's safe, because our bodies are going to respond first physically before we know what's really happening. That's the whole point of fight or flight, right? And so we also have Cook's work, where they did a meta-analysis of 123 studies examining the links between parent-child attachment and children's emotional, behavioral, and adjustment patterns. And so they found that insecure attachment, especially avoidant and disorganized attachment, which we'll get into a little bit later, it was strongly associated with anxiety, aggression, anger, and emotional regulation difficulties across cultures. And so we want to talk about really what culture means. It's way more than race, it's way more than ethnicity. When we are doing assessments and intakes as clinicians, what amount of digging are you doing when it comes to the cultural piece of, let's say, someone's socioeconomic status? How does that affect the relationship that a father would have with their child, where father is out working 12, 16 hours and father thinks he's providing, which he is, but then that does have an impact on the way a child would see themselves, that attachment rupture, if father is not being intentional and involved after work, right? What questions are you asking the families you're working with, the couples you're working with, when you consider things like spirituality as part of a cultural piece, religion as a cultural piece, right? How are you expanding your cultural lens so that you're really digging and asking these questions to get a better idea and to paint a picture of the existing family or the system that you have in front of you? And how can we tease apart together and collaboratively with our clients so that they don't feel shame or guilt, right? These things are important when we're asking the questions. And so with Cook's work, early attachment quality predicts later coping and relational functioning. And these templates or blueprints, like we said a little bit earlier, they persist into early adulthood, into adulthood, including dysregulated templates and even normalized kind of healthy, right? They all kind of flow into how we do life. Unless it's intentionally addressed, like we said earlier, we are kind of stuck, and our clients are stuck in that fight or flight mode, which will come out a little bit later. So Cook and his colleagues, they remind us that unresolved childhood attachment disruptions don't just stay in childhood, they're kind of seeped into our emotional DNA, which is what the GRACE method seeks to repattern once we get to that actual method. So there's lots of research around attachment just in general. And I am pretty sure, as clinicians, as smart as you all are, that you already know what attachment styles are, what that means, and the theory. But I just want to do a quick overview for those who just need the reminder. There are a different attachment styles. There are 4 commonly known after the work that Hainsworth and Bowlby, the father of attachment theory, did way back in the 60s. Anxiously attached people are going to likely sacrifice themselves in order to make their partners happy, to make their children happy, their bosses happy. And remember, it's a template we learned. So if there is, for example, for the sake of this conversation, a disruption in that relationship between father and child, if there is an experience where the father is somehow, even without saying it, forcing, for lack of a better term, the child to make him happy, whatever that may look like, then now I'm anxious and I have to be super attuned to your emotions and your moods and your needs. That sounds like people pleasing, right? That sounds like perfectionism to a degree. And so anxiously attached people are usually not putting themselves first. How does that look when you go to work, right? Maybe you are the overachiever because your father wound has taught you over the years, if not corrected, that you have to volunteer and say yes for everything. When you're in sessions with your clients, how do you ask those questions? For someone who's more avoidant, they may put their walls up. They have a really positive view of themselves and not really that of everyone else. There's going to be some trust issues there for someone who's avoidant. They are maybe today called hyper independent. They don't really believe emotions are very necessary and probably rationalize their way out of the things that they are feeling, because we all have emotions, right? They may appear self-sufficient, but the intimacy piece is really where someone who's avoidant struggles. And that is going to really be a huge testament and probably really obvious in a lot of relationships. You may hear some of our super young millennials, but mostly our Gen Zers, talking about being ghosted. Like that would be the avoidant personality, or at least the avoidant attachment style, I'll say. And so, fearful, disorganized attachment, someone who has that kind of push and pull with themselves, not really a great self image. They are going to want the closeness, but then, oh my gosh, if somebody sees me, I'm not really sure if I'll be worthy, type of thing. And so there's going to be a display of inconsistent behavior, reaching out for the connection, but then also pushing away because at one point, perhaps intimacy was present, but then it went away. Again, we're thinking about back to what our researchers were saying earlier, that push and pull. Was Dad there? Was he not? Was it somewhere in between? Just inconsistent enough to where it made a difference. We kind of all want to be securely attached. That's why I put it on a slide on its own. We want to be the person that understands we may have a negative relationship with our father and had one, but then, working towards the fact that I can advocate for myself and I'm empowered enough to use my voice. So if I am uncomfortable in a relationship, I can lay out my needs, I can listen to yours. I have a sense of autonomy. So you're building relationships on this level of trust with yourself first as a securely attached person, and you trust yourself to communicate those needs. Now, when I'm talking about attachment styles, the caveat is that as much as we enjoy personality tests and self assessments and things like that, we don't want to put ourselves in a box. So I do like to show how attachment has evolved over the years. And so this is more talking about attachment on a spectrum, and where I like to pause and talk about not putting yourself in the box, right? Because I subscribe more to being anxiously attached, just the way that my own relationships have been set up early childhood, especially with my dad. Um, I'm anxious maybe here in like personal, intimate relationships where people really do get to know me once they get to that space. But then I am way secure at work because I know who I am. I know what I've done. I've always been a good student. I'm a hard worker. So secure attachment Christian shows up in different spaces like here, right? I'm really secure. I'm comfortable. And so when we're talking with our clients, especially from a strengths-based perspective, I would encourage you, if you're doing some psychoeducation around attachment with your families and your couples and things like that, to consider that maybe you are secure somewhere else. And how can you pull that out? And how can that person show up in different settings, right? What are those barriers to you being securely attached? Again, on the screen here, what you see is more of a model that shows the spectrum, right? I like the quadrants here. So if you have on the horizontal axis here, a positive sense of self, right here on my left is what I see. You will likely not have as much anxiety. You're pretty confident, secure in who you are. And again, in this upper left quadrant, if you have the positive image of others as well, you'll have low avoidance, meaning like you're okay around people because you know who you are, you show up. This is our secure attached box. Now, if you want to go to a different part of the spectrum here on the vertical line, let's go down to negative image of others. I don't trust people. I've been hurt. My daddy hurt me. I don't trust men. They, in fact, trigger me to the point where I just only stay to myself. Then you're going to have high avoidance of people, right? Places and things, possibly, if it's a traumatic event that was really that impactful. And so we're looking at more of an avoidant, kind of fearful attachment style down here on the bottom right, because you may also have like a negative image of self. And then, I mean, of others and self at the same time. The takeaway here is that, again, I don't want us to put ourselves in a box when it comes to attachment. There is such thing as blurred lines, different settings, bringing out different kind of parts of ourselves, and to encourage your families and the systems that you are treating to be able to see that as well. So what questions would you ask here when you are doing your intake assessments as you are doing treatment in order to help your clients see that? Now, for the sake of Again, making sure that we're speaking the same language and really finally getting into the father wound and what that looks like. This is work that I've been doing since about 2020. And so the daddy issue symptoms are inspired by DSM-4 work, I believe, at the time, going into DSM-5. We're looking at separation anxiety and those symptoms, as well as reactive attachment disorder. That's what inspired me to write the symptoms out this way. And so we're looking at the spectrum once again. I'm not a person that sees things in black and white. So if you have a physical and or emotional absence, all the way to an overbearing and emotional presence of your father or father figure, right? And everything in between, you plug in where you need to plug in. You allow your clients to be able to describe their relationship with their father or lack thereof and how it impacts their feelings and or thoughts of abandonment, of rejection, of worthlessness, of trusting themselves, making decisions, right? So as we're thinking about these daddy issue symptoms, as I call them, and you're asking questions, this is a different way for you to assess. It's a different way for you to maybe talk to your clients who are fathers about their relationships with their fathers and how that trickles down into the system, what that looks like, and how this presence of a father all the way to an absence of their father or father figure contributes to extreme stress. And going back to that research, that stress that triggers that fight or flight or freeze response, that physiological response where your body is going to react first. What is the mention of, I work with students at a university all day. What is that trigger where you have that male professor? Where does that come in? Your boss, when it comes in, how does that trigger you physiologically? And does it go back to that relationship with your father? So this is hopefully going to help you think about the questions you may ask in an assessment. Again, getting to know your clients and kind of bringing up something new. This also calls attention to different systems here. So if we're looking into our family fictional or fictional, excuse me, kinships, like your play cousins and things like that, professional relationships, they're all systems. Your friends, right? Your chosen family. So there may be consistent trouble in manifesting these different relationships and all these different systems because of the attachment rupture that is daddy issues, that is the father wound. And so if we're looking at intimacy, again, going back to attachment style, how is that intimate relationship affected by what you learned about intimacy and closeness when you were interacting or not, again, or anything in between with your father? So we're looking at the symptoms in that regard as well, so that you can kind of pay attention to what to look for. Now, this is different. And after doing some work, I think for probably about 3 years into this, or no, probably like after the first couple of years, I would get feedback from the women that I work with. And that's primarily what my caseload was at the time. We had to talk about this loss, this, I believe I listened to a podcast recently. We talked about disenfranchised loss, right? Like the person's not physically gone or dead. But there is a grief piece where, for like myself, I grieve the relationship with my dad and possibly him and who I was with him, and he still lives, right? And so, what is that experience like when the father figure or the father causes any of these symptoms where you're questioning even your physical mortality? What's going to happen if or when either one of us go? What does that look like? Do I feel guilty? I did something bad, right? Do I feel shameful? I am bad. How much have we internalized because of the status of the relationship with our father? How guilty do I feel that I, quote unquote, can't make it work with my partner? What does that look like? We have to go back to that grief that we may be bringing into our relationships, right? The baggage, as some people like to call it. There are lots of unresolved feelings due to death of a father and a father figure, and just the symbolism behind it all. So what does it actually really mean? And we talked a little bit about culture a little bit earlier, right? So we're questioning the spiritual and religious piece. I'm thinking about Patricia Hayes's addressing model, where we're going through all those different components of what culture really means. And so spiritually, what does it say? Am I guilty now because I'm thinking I'm a bad daughter or son because I'm not speaking to my father? What does that actually look like? So what is that impact? Next, we get into some more intense conversation about what daddy issues could look like, what these symptoms are. And so I'm going to again just remind you to take a deep breath, remind you to take care of yourself during this conversation, because I know that we do very personal work and we bring ourselves into the work. So I just want to remind you to take care of yourself because I have treated clients who have been unfortunately abused in all kinds of ways by their fathers. And that has significantly skewed the way someone shows up in relationships, especially intimate relationships. And so there are going to be those thoughts about why wasn't I protected by the person who we are taught culturally is to look out for me. There are going to be noticeable physical reactions that happen when you consider sometimes sexual intimacy and what that looks like moving forward, the re experiencing, right? So here we kind of get into the post traumatic stress symptoms that still apply, especially when we're talking about abuse by someone who was supposed to protect you. So now we're thinking about the work that we do with, let's just say, a woman trying to escape an abusive relationship, and I'm thinking about trauma bonding and Stockholm syndrome, or what that looks like, where someone in those abusive relationships will go back over and over again because unfortunately it's what you know, it's what you can predict. And although it is unhealthy and it totally throws our nervous system out of whack to be in abusive situations, it is predictable. And that element is strong enough to keep us in those relationships if we're in that abusive cycle long enough. And so, how are we having those conversations? How are we exercising empathy? Keeping that in mind as we are working with those populations where there is severe abuse involved. How are you engaging and interacting in systems where you know that there is danger? What does that look like? Sometimes it's safer, of course, to stay out of the way in terms of solutions to get out of it. So, how are we setting up safety plans? What does that look like? And what is that mindset that leads to decisions to stay in those relationships? Is it missing that you possibly did not ask about the relationship with the father? We're not talking about it being a cause, but it's definitely a contributing factor in just the conceptualization, like how people see things. And I hope that makes sense. So if we get into the let's see, where am I? Shame, doubt. I want to kind of skip ahead a little bit here. Yes, now we're good. Um the doubt and the shame and abandonment, all those things, right, that come with, if you go back to this last slide, abuse, and all the things that come with that specific traumatic experience, especially again by someone who's supposed to protect you, then as clinicians, we know when we are diagnosing, even if you don't diagnose, then it's important to at least ask how long someone has experienced those symptoms. What does that look like? How much of a significant interference has that been for someone in their life, at work, in personal life, with their friendships? How significant is that disturbance? And this is just some kind of just language for us to use, and I translated this for lay people, right? But as clinicians, we know in the DSM, we are looking for how long these symptoms actually impact us. So that is daddy issues in a nutshell. I think that when working with families, it's in the different systems that we do, we can ask the open questions, like I said, about the duration of these impacts. What do you notice? What are you noticing even about yourself when you're in session with them? Because you could normalize and say, this is a lot to take in even now. How are you handling this, and how long have you? Because as we know, for trauma survivors, then it's very common for it to be normal for so long, and they have to be taught that that is not typically how someone would talk to you or treat you. Or I've had conversations with people who say, I didn't have a daddy, so it didn't really matter, so why does this apply to me? I get all those as well. And I think it's worth having that conversation and leaning into something is missing usually, and that is hands down something that people don't want to put their finger on, or can't put their finger on, don't want to admit. And I allow them to say that, and that is their business, right? So the research that we have on attachment, on the father wound, it's pretty vast, right? There are a lot of people who will do the work on their own and kind of work through their parental pain, as this slide says, the father wound, um, kind of in different ways and without like a specific structure. So that's what I want to do is go ahead and move forward to the solution, right? What I have been using for the last 5 years and frankly was doing for a long time before I put a name to it. So I want to encourage you as clinicians to trust yourself. You were likely doing this work already, right? I want to fill the gap with grace and introduce the grace method to you. This is something that I'm really proud of and excited to share because I think it's important that we have something that we can just kind of move through. We have a framework. So I am, if you couldn't tell, trauma specifically trained in certain modalities, trauma informed therapist. And so the grace method is a trauma informed attachment based framework. So I come from the attachment world. I love it. It's interesting to me because I love relationships. And so we're looking at things like the emotional regulation and the polyvagal theory, which we'll get into a little bit later. And the grace method also is in line with samsha's principles of safety, trust, and connection. And so we got to get into what that looks like. And I just want you to see how the grace method matches things that are already existing, so that, I can get a little bit of buy-in here. So we're looking at the GRACE method. It is an acronym. I love a good acronym. It's so easy in a crisis to try to remember things. So when we are using the GRACE method, we are grounding, rescripting, adjusting, connecting, and enforcing. So we're going to get into these elements, and hopefully you'll be able to see by now how this may match some of the work that you're already doing. And so we are establishing that psychological safety, that physiological safety when we are grounding. You likely already have some go-to tips that you use with your clients when you're talking about grounding and mindfulness. And one of the things that I add here, because frankly, sometimes I need a good buy-in, you have to sell it to me to be grounding myself and deep breathing. We have to get our brains back online, right? Our frontal lobe is not going to work properly if we are in fight, flight, freeze, or fawn mode. Those trauma responses throw everything off into survival where we are in tunnel vision. So we have to tell our clients, and it will be helpful to, I'll say, to let them know, like, we're taking deep breaths so that you can think straight. It's not going to be a magic wand to anything by any means, but you're giving yourself a better chance just by taking a deep breath because you're not getting oxygen to your brain. Anxiety is functional. It's there for a reason. We don't talk enough about healthy levels of anxiety where you're planning ahead for things, it gets you up for work, you're going to handle your business. But anxiety at extreme levels, right? It keeps you in the forefront and you're always thinking about the future. And then depression, it would keep you in the past and stuck in the shoulda, woulda, coulda. Those are different little educational and psychoeducational statements I like to use to kind of create buy-in for grounding oneself and bringing them to the present. If someone is experiencing symptoms of a father wound, where in a relationship you literally dissociate, and you may be someone who's super avoidant and you don't handle the now very well, then mindfulness is going to help you stay in the present so that you have a better chance to try to handle business here. So we're practicing our breathing techniques and doing our mindfulness and really becoming aware of our body and what it needs, really with the goal to restore the sense of safety, right, before exploring trauma. So grounding is the first part of the GRACE method. It is helpful to start here because once you start processing with your clients, with your families, your couples, your kids you're working with, then it is important for them to have something to fall back on. You want to teach skills, right? Because you get into conversations that could be super triggering, and then they have nothing to self-soothe. So I say that because I want to let you know in the beginning that the GRACE method, although set out lovely in a nice little acronym, you know your client's needs, and at least you would get to know them. And so I don't want anyone to feel or think that it's a linear process to go through the GRACE method. Now, we'll strongly encourage you start with making sure they have a good toolbox of self-soothing and self-care skills, just again, so that they have something to fall back on if they're triggered. Because once you get to the rescripting, honey, okay, that's where the real work happens, where we are really doing that work. then you're really going to need something to fall back on. But if you know, and I'll say, if you know your clients and maybe they need to stop at like C, connection first, then that's fine. I just want to say that in the beginning before I forget. So rescripting is where we're going to identify and rewrite messages, right? You pull out the negative core messages that may have come directly from father not being there. Maybe dad didn't say you ain't nothing and I don't value you directly. Maybe he didn't verbally say that, but was it his actions? Again, his absence that did say that? You don't know that or have that language as a kid. But thinking back, and when we're taking our clients back to those moments as adults, was that the message? As an adult, you can say that, right? And so we integrate the compassion focus reframing, right? We know how to reframe. It's a lot of things you already know with the goal of shifting from shame, I'm bad, whatever you've internalized, those negative core beliefs, to truth. And you do that with the grace method, rescripting with stuff you already know how to do, right? We all are, at the very least, cognitive behavioral therapists, right? We all know some CBT. And so get out your ABC model. Maybe you've done it one way before. Now you're doing it a different way, keeping in mind that perhaps in the ABC model, where you are looking at the activating event, the beliefs, the core beliefs, which is rescripting, and then the consequences, the emotions and the behaviors that come out of that, then perhaps you're asking your questions a different way. You're focusing on dad, right? Like you've already done the work. Let's revisit that work and see, hey, maybe I can poke some holes in some of these beliefs I have as it relates to the father wound. Remember those symptoms we talked about, right? And so, what else can we talk about? This Socratic questioning, open questions. This is all CBT stuff that you already know how to do. So, rescripting is really great because you get a chance to be direct and intentional when it comes to the things that you need as it relates to um, the narratives that our clients have. So now we're going to get into the A of the grace method. That's adjusting. This is where action comes in, right? So now, hopefully, let's say ideally you're working the grace method and, maybe you did start GRA from the very beginning. And now this is where the action comes in. So we are recalibrating and changing the way we care for self because by now we have self-soothing techniques. We've grounded ourselves. We're in good practice. They're reinforced by what you've rescripted with the client, right? Because now you're telling yourself, I'm actually worth taking the time to self-soothe when I'm triggered. And now it's kind of really making that self-care stick. A lot of people are like, hey, I like to get my hair and my nails done and go to the spa. And they just become empty kind of gestures. But if we are intentional in putting words and narratives that are new and practicing that behind the self-care, this is what makes it kind of stick around, right? We want to introduce self-care and relational boundaries with the goal of really just kind of putting this into daily life. Connecting is really important. We talked about connection, right? Attachment styles impact the way that we connect to people. The attachment style was shaped again, for the sake of this conversation, by the relationship with dad. How does that get in the way of connection? So you're relearning safe connection through community and therapy, possibly faith-based communities, right? We're practicing co-regulation in community, right? That is where we are getting together to make sure that we are talking about the Me Too's. My dad wasn't great either. Oh, yours? Why not? Tell me what that looks like. Community is healing. Shame can't live in it. That's what Dr. Brene Brown says. The goal with connection is to strengthen your attachment template or recreate. Now, I also want to say in this moment, you want to normalize the difficulty in connecting because trauma survivors, of course, if they have been hurt by people and people are not safe, we may have to slow walk that thing, right? So normalize the difficulty for trauma survivors, allow them to talk, giving them voice and choice about how scary it can be to connect, right? So what interventions are you using to reestablish trust so that it's more effective when you get to this connection piece? And then not taking for granted that you as the clinician are also helping recreate what safety looks like in community, which we're going to talk about a little bit later too. And enforcing proper boundaries. This is what the enforce means. And so we're looking at the goal of making sure that we're empowering that voice and choice for clients. Yes, I want to have this relationship with my dad, or I don't. I may have set a strong boundary because it was healthier for me to stay out of that toxic cycle. And that's okay. And then we can talk about, again, that grief that comes with a distance relationship that's new because of what's going on. So you have a chance to teach the benefit of setting the boundaries and discussing their fears, thinking about the people pleasers, right? Because it's really hard for us to say no to people. I say us, I'm a people pleaser in recovery. And calling back to Stockholm syndrome, is it scary for you to set that boundary? What does that look like? How can we help our clients be safe as we're doing that? So, all in all, with the GRACE method, we are promoting these three things. Best practice through SAMHSA's principles, the six principles that are there for trauma informed care. We want to establish safety. That's what grounding does, right? Our bodies need to be safe in order for us to process any narratives or things that come forward. We're trying to establish trust and connection. All those things are very helpful when it comes to doing this trauma work. And yes, I say trauma work again because this attachment rupture, specifically father wound, can be that. Now, one of the things I wanted to share with you all was just a little bit of research in terms of adult attachment. Fraley and Roisman did some cool work a few years ago. The review that they did, it summarizes some longitudinal research about adult attachment. And so the key finding there, it was really about stability and change is what they were looking at. Like, what does attachment look like over time? Adult attachment patterns are moderately stable. That's what they find. So they're going to be the same over time, but they can change through corrective emotional experiences like that of connection and the right community, new relationships, and effective therapy. So, what we take away from their research is that it challenges the idea that attachment styles are set in stone. We know as clinicians that idea of neuroplasticity, where we can learn new things. Our brain can, in fact, change and learn new habits if we're very intentional about the way that we go about learning new things. So, it supports the framework, something like the GRACE method, because it provides a structure, the GRACE method does, for creating that secure attachment in adulthood. And then here, Natsu and his colleagues did a meta-analysis examining how adult attachment styles they relate to therapeutic working alliance. So this is really important because sometimes if you are someone who is avoiding attachment because you don't want to be around people, you put your walls up, intimacy is just not where it's at for you, then if you have a family or a couple of your clients come to you, then you have a chance to recreate a healthy alliance. Like you get a chance to share with them that connection can be productive. And so what they found is that clients with anxious or avoiding attachments report a weaker alliance, connection, rapport with their therapist, while increases in attachment security, right? So securely attached people predict stronger therapeutic relationships and they have better outcomes. And so attachment security is not just personal, it's relational. So how are you building rapport with your clients? The GRACE method is offering that roadmap for clinicians to build safety and trust. Just early in the process, strengthen the alliance, checking throughout to see whether or not it's something that's working for them, was uncomfortable, really assessing throughout the time. We know assessment does not stop. And so strengthening the alliance and facilitating helps facilitate long-term change. So I just wanted to offer this reminder here about adult attachment. It's going to evolve over time. In the beginning, we talk about those four attachment styles. Remember, we are not going to put ourselves in a box. You could evolve over time. It could be on a spectrum. And just as a reminder for adult attachment, where does your client land and why? What contributes to that? This is going to be a great time for us to have more conversation about what that looks like. And then again, we're bringing up Shore again, where, you know, his research integrated that neuroscience, the attachment theory to explain how early caregiving relationships are so crucial. They shape the developing brain. So particularly remember the right hemisphere where our emotions are housed. He found that chronic misattunement or neglect from caregivers lead to that autonomic dysregulation, which gets us into Porrage's work when we talk about the polyvagal system, right? So another reminder that the father wound, which can be categorized as a traumatic event, right? If it is a disruptive, unhealthy relationship, all the way to overbearing in the presence of your father, right? Everything in between, we're categorizing it as, for the sake of the conversation, something that can be traumatic. Traumatic events have the ability to stick with us physically. Our bodies will download the impact of that trauma. So Porges's work gets into the polyvagal theory that explains how the vagus nerves, it governs our physiological responses to safety and danger and connection. And so the theory identifies those three autonomic states where, you have the social engagement and safety, the ventral vagal system, fight or flight, sympathetic nervous system, and then the dorsal vagal system. And so going back to the Grace method and how grounding helps us to address that physical response, it's really great to know, how does trauma affect the body? And if you want to work backwards just for yourself, again, to inform how you're asking questions from the beginning, how can we help our clients become unstuck, so that we are not so that we're actually making progress? And you may spend more and more time teaching and getting buy-in for your clients in terms of what it looks like to take care of your body, right? You may spend a lot of time just on grounding. You may not be the clinician to take them to that space where they make the quote unquote breakthrough we love to have, right? But just know that you're making the difference you need to, okay? As we're wrapping up here, this is just another way, a list of the 6 different principles from SAMHSA and how the Grace method actually does apply. And it's really kind of calling on those things in terms of how we actually implement the work. And I want us just to have one more little example here of how, ideally, in a perfect world, if you're addressing the father wound, then this is what it could look like, right? Using the Grace method. A college student feels unseen by her father. We begin with some grounding, breath work, safety cues. She does that maybe for a few sessions. We do another few sessions, rescripting. She reframes his absence as his limitations and not her lack. Again, rescripting is where a lot of work happens. It's where we do our therapy. She's adjusted her routine, so we're getting into more self-care. She's built that foundation, grounding and rescripting her messages and making things stick. She's able to make those connections and enforce those boundaries for people, places, and things that don't serve her, right? And so over time, she's moving towards that secure attachment. So again, as systemic thinkers, we are the instrument, and the Grace method is now hopefully your vessel, the main means that you will use to kind of build that bridge. When we model repair in our sessions, we invite families and communities into healing. And so father wounds are systemic attachment injuries. So how are we going to, from now on, going to address those questions? What are we going to do when we do not hear about the father? Are we going to be bold enough to ask those questions? Because we know that if there's a pattern we see about relationships with our clients, that secure attachment can be developed, right? They may be stuck in an insecure attachment style that's not serving them. So how are we going to help bring that out of them? And hopefully after this presentation, you will have seen how the Grace method can contribute to things like healthy and secure attachment. As always, and I just want to make sure we get it on the screen, this is backed by several references that I have actually pulled upon so that you can go back and read something about how this work is found in research in terms of how to be trauma informed when we're doing our work. And I hope that you have learned something, taken something away in terms of what daddy issues are, the father wound, and how to address it. Again, I am Christian Jackson, the daddy issues therapist, and I hope to find you soon. Thank you.